I'd like to get over to Congressman Gingrey from Georgia, another medical doctor joining us, many years of medical practice, also a former senator from Georgia, and a great colleague. Yield time.
Well, I thank my colleague for yielding, and it's a pleasure to be on the floor with my colleagues talking about this bill that was finally, as we all know, introduced by Speaker Pelosi at a press conference this afternoon. And, you know, hearing our colleagues from Tennessee talk about really the ultimate pilot project. We're always in Medicare, anytime they're trying to do something to improve a situation, we start with a pilot project, which makes sense. Well, this was the ultimate pilot project, I think, this TennCare that Congresswoman Blackburn and Dr. Rowe, Congressman Rowe, have described to us, and as their Democratic governor said, it was a complete abysmal failure. And yet
we're going to repeat this. Please continue.
If the gentleman will continue to yield,
I do.
And yet we're going to repeat this now on a grand national scale. I want to just take a few minutes to talk about what the Blue Dog Democrats said to their leadership just last week in a letter that was sent to the Honorable Nancy Pelosi, Speaker of the House, Madam Speaker, and the Honorable Steny Hoyer, the majority leader of the Democrats. And 40, I think there are 52 members of the Blue Dog Coalition of Democrats, those members who are a little more conservative than the typical moderates to liberal Democrats. And basically these 40 members, 40 out of 52, and there are a number of things in their letter, but I just want to go over a couple. One of the provisions that they say that absolutely needed fixing in this bill before they could support it: small business protections. And here's what it says: any additional requirements for employers must be carefully considered and done so within the context of what is currently offered. Small business owners and their employees lack coverage because of high and unstable costs, not because of any unwillingness to provide or purchase it. We cannot support a bill that further exacerbates the challenges faced by small businesses. Now, look, my colleagues, what this bill says that just came out today. This is the burden, the additional burden that will be put on small businesses. Payroll, if the payroll of a business does not exceed $250,000, then there's no surtax. But if the payroll exceeds $250 to $300, there is a 2% surtax. If the payroll exceeds $350 but does not exceed $400, there's a 6% tax on small business. And if the payroll exceeds only $400,000, an 8% surtax on these small businesses. And what I want to make sure everybody in this chamber understands, these small businesses, they're not subchapter, they're not C corps, they're subchapter S, or they're sole proprietors, and they pay as an individual. And this is on top of the fact that President Obama is going to let the tax cuts expire that President Bush put in place in 2001 and 2003.
So just reclaim my time for a minute. What you brought up is an absolutely critical point. It's part of how they're going to try and pay for this humdinger bill. And what you're saying is they're going after small business. Now, small business, a lot of us know, you take small business as 500 employees or less, that's 80% of the new jobs that are created typically in the economy. So if you target small business, now you're going to drive down employment. And that's significant. The gentleman from Arizona, I yield him time. You wanted to...
Yeah, I am shocked. As I stand here, I got to tell you, I'm absolutely shocked. I understand that the gentleman from Georgia was reading from the bill just now. You were reading provisions of the bill that was released today?
Reading directly from that provision, taxes on employers and individuals.
So you've read a portion of this bill?
I have read a portion of this bill.
And I suggest that you also read from a letter written by Blue Dog Democrats, conservative Democrats, to their leadership, expressing concerns about provisions of the bill before it was released today, the so-called tri-committee discussion draft. So are you telling me that Blue Dog Democrats have read portions of the bill?
The gentleman from Arizona is absolutely right. The one of the provisions that they stated in the letter is this. Finally, any health care reform legislation that comes to the floor must be available to all members and to the public for a sufficient amount of time before we are asked to vote for it.
I'm just stunned. I have here beside me a quote from the House Majority Leader, which suggests that it's not appropriate in America for us to expect members of Congress to read bills. As a matter of fact, the Majority Leader said, if every member pledged not to vote for it being this health care bill, if they hadn't read it in its entirety, I think we would have very few votes. You know, he said last week he laughed out loud at the notion that members might actually read a bill. I suppose if you'd done what he did, which is on the cap and trade bill, introduce at 3:04 in the morning a 309-page amendment, which made it impossible for a single member to read the bill before it was voted on at 4 p.m. that afternoon or 5 p.m. that afternoon, then I guess you'd have to say, gosh, we don't want members to read bills. But as I understand it, you are reading this bill, and so are these blue dogs reading the bill?
Well, if the gentleman from Missouri will continue to yield, and I can respond to the gentleman from Arizona, absolutely. And again, in this letter, and I'm quoting directly from the letter, too short of a review period is unacceptable and only undermines Congress's ability to pass responsible health care reform that works for all Americans. And our colleague from Tennessee, Dr. Rowe, just held up that 1,100-page bill. I wonder when they're going to get around to reading it. And I yield back.
Yes, I would like to yield time to Congresswoman Blackburn from Tennessee. I think you had a point, and also that